Good morning, everyone. Thank you for joining us today for this first session, Cutting Forever Short, Taking Action on PFAS Today.
Thanks, Betsy. Good morning, everyone, and thanks for joining us today. This session will cover EPA's PFAS regulatory updates, as well as the recent designation as a CERCLA hazardous substance. The West Virginia Department of Environmental Protection and the West Virginia River Coalition will share on their community engagement for PFAS action plans. And finally, the Maryland Department of the Environment will talk about their wastewater treatment plant PFAS survey. If you have any questions, again, please share them in the chat. We will get to them later if we have time, or we'll have our panelists follow up with you directly. Our speakers today include Bill Richardson, Chief of the Drinking Water Section at EPA Region 3, Laura Mohollen, Chief of the Superfund Technical Support Branch with EPA Region 3, Scot Mandirola, Deputy Cabinet Secretary at West Virginia DEP, Casey Korbini, Deputy Director for Remediation Programs at West Virginia DEP, Autumn Crowe, Interim Executive Director of West Virginia Rivers Coalition, Noni Howell, Administrator of the Wastewater Pollution Prevention and Reclamation Program at MDE, and finally, Yen-Der Chang, Chief of the Municipal Service Discharge Permits Division at MDE. I will now pass it over to Bill to get us started. Thank you.
Hey, good morning, everyone. So I'm going to provide a short, high-level overview of EPA's recently promulgated National Primary Drinking Water Regulation for PFAS. Next slide, please, Hunter. So first, I would just like to start with some key messages surrounding EPA's PFAS rule. So there is a large body of science demonstrating that PFAS exposure over a long period can have significant health impacts, including impacts to critical life stages such as pregnancy and early child development. EPA's data analysis that was performed as part of this rule showed that PFAS pollution can also have a disproportionate impact on small, disadvantaged, and rural communities that are already facing increased environmental contamination. So as the lead federal agency responsible to protect drinking water, EPA took a signature step last month to protect public health by establishing legally enforceable drinking water standards for 6 PFAS compounds. And EPA used the best available science on PFAS to set these national standards. And the PFAS rule will reduce PFAS exposure for approximately 100 million Americans and prevent thousands of deaths and tens of thousands of serious illnesses. Next slide. So this graphic shows a very simplified process of developing a national primary drinking water regulation. So the first step of the process is that EPA gathers the best available science and supporting information to determine if a contaminant is likely to occur in public water systems with a frequency and at levels of public health concern. And if the answer is yes, then a drinking water regulation is needed. EPA then develops a maximum contaminant level goal, or an MCLG, and the MCLG is a non-enforceable level at which no known or adverse health effects are anticipated to occur, and also includes a margin of safety. MCLGs, though, do not account for limits of laboratory detection or treatment technology effectiveness. The next step of the process is a maximum contaminant level, or an MCL, is set as close as feasible to the MCLG. And the MCL does take into consideration what technologies are available, along with both costs and benefits. And then finally, if the benefits of the rule justify the costs, then the rule will be proposed and then finalized after a public comment period. Next slide. So this slide provides a summary of EPA's PFAS rule. First, the maximum contaminant level goal. For PFOA and PFAS, EPA is setting a non-enforceable health-based goal of 0. So this reflects the latest science showing there is no exposure of these 2 PFAS without risk of health impacts. For PFNA, PFHXS, and HPODA, more commonly referred to as Gen X chemicals, EPA is setting MCLGs of 10 parts per trillion. Next up for the MCLs, EPA is setting enforceable maximum contaminant levels at 4 parts per trillion for PFOA and PFAS individually. This standard will reduce exposure from these PFAS compounds in our drinking water to the lowest levels that are feasible for effective implementation. For PFNA, PFHXS, and Gen X chemicals, EPA is setting MCLs of 10 parts per trillion. And EPA is also regulating through a hazard index mixtures of 4 PFAS, PFHXS, PFNA, Gen X, and PFBS. And decades of research shows that some chemicals, including some PFAS, can combine in mixtures and have additive health effects, even if the individual compounds are each present at low levels. And the hazard index is simply calculated by adding the ratio of the drinking water sample concentration to a health-based concentration to see whether or not that ratio exceeds 1. Next slide, please. So I mentioned earlier that analyzing both costs and benefits is a key component of the drinking water rulemaking process. EPA's analysis during the PFAS rule development determined the final rule will save thousands of lives and prevent tens of thousands of illnesses. And EPA considered costs associated with lost wages, medical bills, and the value of every life lost. And the quantifiable health benefits of the rule are estimated to be $1.5 billion annually. And there are also many other substantial health impacts that will be avoided, which EPA does not have data to quantify. Next slide. So the PFAS rule will also have costs associated with the implementation. EPA estimates between 6 and 10% of public drinking water systems will need to take action to reduce PFAS to meet new standards. Compliance costs are estimated to be approximately $1.5 billion annually. These costs include drinking water quality monitoring and the costs associated with reducing levels of PFAS in drinking water, either through treatment or obtaining a new source of water. So in the final rulemaking process, EPA considered all available information and analyses for both costs and benefits, quantifiable and non-quantifiable, for the rule, and determined that the benefits do justify the costs. Next slide, please. So this slide provides some information on the timeframes laid out in the rule. So starting with the first part of the implementation is within the first 3 rules, initial monitoring is expected to be completed by public water systems. So water systems have 3 years to do this initial monitoring. EPA's PFAS rule protects public health, but does provide for some flexibility and cost savings and potential burden reduction for public water systems. One of those flexibilities is the allowance of using previously collected drinking water PFAS data to satisfy the rule's initial monitoring requirements. EPA is aware that there are a lot of water systems that have been getting ahead of the PFAS rule and have been doing voluntary monitoring. And there's some potential ability to use that monitoring to comply with that for initial monitoring requirement. There are some caveats with using previously collected data. Previously collected data will need to meet both the federal requirements and state requirements, but those data may be usable to satisfy that initial monitoring requirement. The next time frame, which would start 3 years from now, is that water systems will be required to share PFAS monitoring results with their customers in their annual consumer confidence reports. And water systems must also begin regular PFAS monitoring and notify the public if they fail to monitor for PFAS. And lastly, in 5 years, water systems are expected to comply with all MCLs and provide public notification of any MCL violations. The 5-year timeframe provides additional time to comply with the PFAS MCLs. After a lot of public comment, EPA determined should be more time allowed for water systems to plan, design, and find the best available solutions for their communities. While the rule is flexible, it does allow systems to determine the best solutions for their community. But that is something that should be done in consultation with their primacy agency. Next slide. So finally, I would like to take a minute to talk about the funding available to help communities implement the PFAS rule. There is a significant amount of funding that is being provided to states via the bipartisan infrastructure law. PFAS contamination can have a disproportionate impact on those small and rural communities, and there are funding options specifically for these water systems. The bipartisan infrastructure law has made available billions of dollars through the state revolving fund programs to invest in communities, with drinking water impacted by PFAS. EPA also has free technical assistance available to communities through our Water TA program. The Water TA program can help communities access water infrastructure funding from their state SRF programs. And I understand implementation of the PFAS rule will be challenging, both technically and financially. And if you're in a community that needs support, I, encourage you to reach out to either your state primacy agency or make a request through EPA's Water TA program. Next slide. So just on this slide, if you have specific questions surrounding the PFAS rule, there is a website that has a lot more details. EPA's website. There's also a EPA PFAS mailbox. If you have any questions, you're also welcome to contact me directly. That's all I have to share for you today. Thank you for allowing me to share some of that info with you today. Now I'm going to pass it to Laura Mohollen from EPA's Superfund Technical Support Branch. Thanks all. Take it away, Laura.
Thank you, Bill. Good morning, everybody. This morning, I'm going to walk through EPA's recent action on listing PFOA, PFOA, and PFAS, PFOS as CERCLA hazardous substances. CERCLA is the Comprehensive Environmental Response, Compensation, and Liability Act, which is also commonly known as the Superfund. EPA is designating PFOA and PFAS, including their salts and structural isomers, as hazardous substances under CERCLA. This is because significant evidence demonstrates that when released into the environment, these chemicals may present a substantial danger to public health and the environment. As you heard from Bill, we know that they're linked to severe adverse health effects, including cancer. We know they're persistent and prevalent in the environment. And we know that these chemicals and their precursors have been used in industry and consumer products since the 1940s, and many times were improperly handled and disposed of into the environment. This action is to prevent further contamination and address existing contamination from past industry practices. This rule was published in the Federal Register on May 8th of this year and will be in effect 60 days later on July 8th of this year. Next slide, please. So where does EPA get its legal authority to do this? This comes from CERCLA Section 102, which says, the EPA administrator has the ability to designate hazardous substances that, when released into the environment, may present substantial danger to public health or welfare or the environment. This is the first time EPA has used CERCLA Section 102 authority to designate a hazardous substance. Currently, there's over 800 CERCLA hazardous substances, and this is because CERCLA incorporates by reference hazardous substances listed or identified under several other environmental acts, including the Clean Air Act, the Clean Water Act, the Resource Conservation and Recovery Act, and the Toxic Substances Control Act. Next slide, please. So what does this rule really do? Prior to our designation of PFOA and PFAS as CERCLA hazardous substances, there was no rule requiring reporting of releases of PFOA and PFAS. There were no requirements for federal land transfer of PFOA or PFAS contaminated federal properties. There were no Department of Transportation regulations. And in order for EPA to take an action to address a release or threat of release of PFOA or PFAS, we had to demonstrate it was an imminent and substantial danger before any response could take place. We also did not have the authority to compel potentially responsible parties to clean up or pay for PFOA or PFAS contamination. Now, with the hazardous substance designation, this raises the status of these chemicals. It allows us to do more to address the issue. We now have release reporting requirements. Entities must report releases that meet or exceed the reportable quantity of 1 pound in a 24-hour period. I don't think you're on the right slide, Hunter. Yeah, if you could go back a couple. Okay, I think some of the slides may be missing, but that's okay. We're just going to roll with it. So it also now requires federal land transfer. Any federal entity transferring or selling property which has been contaminated with PFOA or PFAS must provide notice of the contamination and cleanup. There are now Department of Transportation requirements, so PFOA and PFAS must now be handled as hazardous materials under the Hazardous Materials Transportation Act. The designation also enables EPA to shift responsibility for cleaning up PFOA and PFAS contamination from the Superfund to those responsible for the contamination. And it allows us to order potentially responsible parties to conduct the response action. I would say next slide, but I don't think you're going to have it. So I'm just going to keep talking through some of the key points here. The benefits of this rulemaking. So there are many benefits to this rulemaking, and I'm going to highlight a few. So we know that there will be human health benefits due to the reduced exposure to PFOA and PFAS. It's going to allow us to address contamination sooner. Earlier responses will reduce risk. It will have a cost savings from addressing contamination sooner. It will have incidental cleanup of co-contaminants, and we expect that it should increase property values near cleanup sites. It also hopefully will help motivate entities to take greater precaution to prevent environmental releases to avoid reporting requirements and liability. Some things the rule does not do. It does not require facilities to proactively sample, test, monitor. There you go. That's the right slide. Does not require facilities to proactively sample, test, monitor, or clean up PFOA and PFAS. It does not automatically require any investigation or cleanup actions. It doesn't impose requirements on any facility on how they need to manage contaminated waste or wastewater. It does not require PFOA or PFAS waste to be managed at RCRA Subtitle C or hazardous waste facilities. It's not going to add any site to the national priority list or require that EPA re-examine existing sites. And it does not automatically impose liability. One of the actions the agency took to alleviate concerns of certain entities was to release an enforcement discretion policy with the finalization of this rule. Next slide, please. Next slide. Next slide. Okay, I think they're a little out of order. That's okay, that's the right slide. There you go, thank you. With the announcement of the final hazardous substance designation, EPA also released an enforcement discretion policy. This is publicly available on our website. And in general, the policy states that we will exercise enforcement discretion as we do with any other hazardous substance. The agency will focus on holding responsible those who significantly contributed to the release of PFAS into the environment. We do not intend to pursue entities where equitable factors do not support seeking response actions or costs under CERCLA. And this could include entities such as farmers, water utilities, publicly owned airports, or local fire departments. And if you could then go to the slide that talks about RCRA. There you go, that's the right slide, thank you. So finally, I just wanted to quickly touch base on two proposed rules, which were both published on February 8th of this year, which address certain PFAS under the Resource Conservation and Recovery Act. The first rule proposes to add 9 particular PFAS compounds, their salts and structural isomers to its list of hazardous constituents in RCRA. To be listed as a hazardous constituent under RCRA, scientific studies must show that the chemical has toxic, carcinogenic, mutagenic, or teratogenic effects on humans or other life forms. EPA has evaluated toxicity and epidemiological data for these chemicals and determined that these 9 PFAS compounds meet the criteria for listing as a RCRA hazardous constituent. This would facilitate additional corrective action to address releases of these specific PFAS at RCRA hazardous waste treatment, storage, and disposal facilities. It would not require the suite of cradle-to-grave management controls that are associated with RCRA hazardous waste. The second proposed rule would amend the definition of hazardous waste as it applies to corrective action to address releases from solid waste management units at permanent hazardous waste treatment, storage, and disposal facilities. If finalized, it would show clear regulatory authority to address emerging contaminants that are not included under the regulatory definition of hazardous waste. It would require RCRA's corrective action program or their cleanup program to address releases not only of substances identified as hazardous waste in the regulation, but of any substance that meets the statutory definition of hazardous waste. The public comment period has closed for both of these rules, and EPA is currently evaluating the public input we received. I'd like to now pass it on to Scot Mandirola from the West Virginia Department of Environmental Protection. Thank you. Scott?
Thank you, Laura. Can you hear me okay? Hunter?
Yes.
All right, thank you. I'm going to discuss West Virginia's community engagement for PFAS action plans. And in order to get to this, I need to give you a little history. If you could go to the next slide, please. This whole study and analysis that led up to the PFAS Protection Act began back in 2019, but I wanted to put this slide in here because this was a legislative finding in the PFAS Protection Act, which passed in 2023, and I think it's an important statement that the legislature and a stand that the legislature took. And it is imperative to identify the remaining sources of PFAS detected in raw water sources for public water systems so that these sources of pollution can be properly addressed, minimizing the impacts to public drinking water systems. I think it's very important that we've identified the main exposure pathway to West Virginia as drinking water, and the legislature has found that they don't want to make that the responsibility solely of the public drinking water systems. Can you go to the next slide, please? As I said, back in 2019, West Virginia put together a PFAS work group made up of USGS, Bureau of Public Health, and the DEP. The main purpose of this group was to try to determine how extensive is the PFAS issue in West Virginia. And since the main pathway has been identified as drinking water, USGS had done some studies along the Ohio River corridor in some monitoring wells for PFAS. So we enlisted them to decide how the best approach to address this was. So what we did, we got with Bureau of Public Health, identified that there are 279 drinking water intakes regulated by the Bureau of Public Health as public systems. This includes anything that serves more than 25 people in a day. So there's daycares and schools involved in this as well. We contracted with USGS to test the raw water at each of these locations. And this is a distribution on the map of all of our systems. The triangles are the surface waters, where the circles are the groundwater. And you can see it's pretty well distributed across the state, but it's not evenly distributed as far as groundwater and surface water. The areas along the Ohio River corridor, the Eastern Panhandle, and the Southern coalfields tend to have more groundwater, and the surface waters are more evenly distributed throughout the center of the state. Now, we knew that there was 2 locations in the state that we had PFAS problems. The area around Parkersburg near the Comores facility and the area around the Air Guard base in Martinsburg. Both had been previously identified, but we did not know the extent of the remainder of the state. Can you go to the next slide, please? We did a raw water study, as I said, at all 279 sites across the state. Now, I'm not going to go through all the statistics for each one of these different PFAS compounds, but if you look at the very first bullet on this one, the PFOA, which is C8, and PFOS, which is AFFF firefighting foam, 37 sites had hits above the PQL. That's 13% of our water systems. 100 sites had hits above the MDL, which is the minimum detection limit, but below the practical quantitation limit. That's 36%. So we had a total of 139 systems, 137, which is 49% of our systems had hits above EPA's health advisory. That's pretty significant. Go to the next slide. These individual, I want to get some general statistics across. General statistics for this study. At the time, there was 28 PFAS compounds. Now it's up to 40 something that are in a routine analysis. But at that point in time, there was 28 PFAS compounds being tested for. 166 sites had hits above the minimum detection limit for PFOA, PFOS, PFBS, or Gen X. These are significant because these, as discussed earlier, were the compounds that are regulated in the for the MCL, okay, for drinking water systems. So these have some significance in that respect. 48 sites had hits above the minimum detection limit for other PFAS compounds, other than the ones that have been regulated by the drinking water program, which means that 214 sites overall in the state have hits. That's 77% of our water systems have a hit for some PFAS compound above the minimum detection limit. Next slide, please. This led us to immediately follow up this study with a finished drinking water study. As I said, the previous study was all done on the raw water coming into the water treatment facilities. This study we picked up, and Bureau of Public Health spearheaded this, picked up the 37 sites or intakes with the highest level, and we tested those, the finished water coming out of those facilities in 2002 to see where we were. Now, keep in mind, there's a lot of treatment going on around the Parkersburg facility through a Safe Drinking Water Act order with Chemours. So some of these systems that had it in the raw water did not have it in finished water because they have carbon filtration already. But 19 systems had hits above the new MCL that EPA just discussed. That's significant. All of those are going to need treatment to come into compliance with the MCL. 9 had hits below 4, but we're still above the MDL, which means they have the potential to exceed some of the MCLs. 27 had hits above the health advisory. 7 had hits above 1, which is the hazard index. Next slide, please. This led to the PFAS Protection Act. In 2023, the state legislature worked with the DEP as well as a number of NGOs, including Rivers Coalition, and got the PFAS Protection Act passed. It did 5 main things, and I'm going to go through each one individually. So let's just go to the next slide, and I'll hit the first bullet point. The first thing it required was that the DEP initiate a study to test the finished water for the next 100 highest intakes. And that had to be initiated by 2023. DEP initiated the study with USGS. Currently, EPA is approving the QAP for that. We actually did 106 because we had, again, that health advisory or the hazard index. We identified 6 that had it above the hazard index, and we wanted to include those in this. To be consistent with EPA's UCMR 5 requirements that are going on now, we're testing these for both 533 method and 537.1 method. So each one of these samples has to be tested twice. The cost of this study is about $446,000. And again, that'll be running both samples or each sample twice. You can go to the next slide. The second thing it required was industry which manufacture or use or have used PFAS chemicals in their production process to report to the DEP that use. And then the DEP is required by this act to add quarterly monitoring to their discharge permits. A letter was sent out by DEP to all NPDES permit holders in August of last year. That letter notified them of their responsibility under the act. The facilities reported to the DEP on time by the end of last year, and 6 companies reported the manufacture or use of PFAS. So a letter is being sent out to all 6 of these, notifying them that we are modifying their permits to require quarterly monitoring. Next, please. Require DEP to develop action plans. That's the major point of this presentation. And I'm not going to touch too much on this because both Casey and Autumn are going to talk about it. But the one thing I will say is the legislature, when they did enact this law did not give us any money to do it. And you can see we've already spent in the neighborhood of $500,000. So in order to do the action plans, we partnered with 20 NGOs led by Rivers Coalition to apply for $1 million grant to do this outreach and these action plans. But that'll be discussed a little bit more later. Next slide, please. It also required the DEP to establish or adopt an appropriate water quality standard after EPA establishes a recommended water quality standard. EPA's PFAS strategic roadmap indicates that EPA has planned to do that by fall of 2024. Now, I'm not sure if they're still on that schedule. Perhaps EPA online might be able to inform us of that, but at this point, I have not heard anything to the contrary. So this would put, because our rulemaking cycle for our legislature starts in May, and unlike some states, our water quality standard has to go through our legislature. So if the current 2025 session, which will begin in February, that rulemaking has already started. So if they do come out with this in 2024, then the rulemaking cycle that it will go into would be 2026. Next slide, please. The last thing the bill required was that water companies report findings of PFAS in the UCMR5 to the customers. That's already begun. UCMR5 data has already being submitted to Bureau of Public Health, and those water companies then will be required to do that. Next slide, please. At this point, I'm going to turn it over to Casey Korbini to continue with the slide. Thank you.
Thank you, Scott. I'm going to provide an overview of DEP's community engagement pilot project in EJ communities overburdened with PFAS contamination in drinking water, which is being funded through an EPA Environmental Justice Government-to-Government grant. So during the 2023 legislative session, when the PFAS Protection Act was being considered and then ultimately passed, the West Virginia Rivers Coalition saw a request for applications announcement concerning the EPA Environmental Justice Government-to-Government grant. And they reached out to DEP, shared the announcement with us, and asked if we'd like to apply, with the West Virginia Rivers Coalition serving as the community-based nonprofit organization, also known as a CBO. And it's important to note that with the EJ government-to-government grant, they're only awarded to partnerships between a government entity, either state or local, and a community-based nonprofit organization. So we instantly realized that this was a great opportunity to develop initial PFAS action plans, pilot community engagement activities, and then refine a process for completing the remaining PFAS action plans. The community engagement aspect is particularly important for identifying and addressing PFAS sources. So attempting to track down locations or specific activities where previously unregulated substances were used, and potentially decades ago, can be quite difficult without community and institutional knowledge. For instance, while USGS performed sampling in a community, a local citizen walked up and asked what they were doing. And after conversing for a while, the gentleman casually noted that the now empty field that looked very innocent had been used for years as a firefighting training area. And when the sample analysis returned, as you can bet, PFAS was detected. Our Region 3 neighbor, Virginia, also can attest to the importance of community engagement while tracking down sources of PFAS. So in 2022, high levels of Gen X were detected in a local water system. The water system worked with VA/DEQ to identify potential sources and collect samples from source water. And at the same time, a public notice was published in the local newspaper. While a former employee came forward with information about his former employer and its operations, and that helped VA/DEQ and the local water system successfully reveal the source, and it aligned with their sample results. So this is a really important part of the process. Next. So what is the Environmental Justice Government-to-Government Program, also known as EJ-G2G? The purpose of the Environmental Justice Government-to-Government Program is to support and/or create model state, tribal, local, and territorial government activities that lead to measurable environmental or public health results in communities that are disproportionately burdened by environmental harms and risks. And the model should leverage or utilize existing resources or assets of state, tribal, local, and territorial agencies to develop key tools and processes that integrate EJ considerations into all levels of government and government programs. Goals of the program include achieving measurable and meaningful environmental and/or public health results in communities, building broad and robust results-oriented partnerships, particularly with community-based nonprofit organizations within disproportionately impacted areas, piloting activities in specific communities that create models, which can be expanded or replicated in other geographic areas, and strengthening the development and implementation of specific approaches to achieve environmental justice. So as you can see, this grant program was a perfect match for our project. However, I will note that a broad variety of projects and activities can be funded through the EJ G2G grant, and I highly encourage you to look at the EPA website for more information about the program and the grant. Next. DEP and the West Virginia Rivers Coalition worked diligently together to outline our project and complete a grant application, which was submitted in April of 2023. We determined that we would focus on 2 geographic locations that each had a high number of communities impacted by PFAS, the Eastern Panhandle and the Northern Panhandle. These are predominantly rural areas with many communities located in coal and energy communities. And within those areas, 11 communities operating 15 public water systems required PFAS action plans. And if you're listening to Scott earlier, he had mentioned initially identifying 37 public water systems. So this was close to half of those systems just by targeting those 2 areas within this project. We knew that by focusing on those geographic locations, we could more easily concentrate our public outreach and community engagement efforts without stretching our resources too thin. Next. After anxiously awaiting for months, we received notification of selection in October 2023, and that was a great day. We worked with our grant project officer, Grace, and our grant specialist, Haley, to complete final documents with the hope of starting the project by February 1st of this year. Unfortunately, the final award was delayed due to funding issues associated with the continuing resolution. However, we finally received the $1 million award last month and have begun implementing our proposed project, which will span over the next 3 years. We're so excited to get this project rolling. Unfortunately, because we're so early in the project implementation, we can't share results and lessons learned with you today. However, we want to share our project proposal and plan activities with you. Next. So through the EJ G2G grant, the DEP, the West Virginia Rivers Coalition, and other partners will design and implement a community engagement process by researching effective methods and convening and coordinating a design committee. Then we'll implement that design community engagement process by informing project partners, deploying community ambassadors, and holding community meetings. We'll identify and confirm sources of PFAS contamination through a collection of community knowledge and confirmatory environmental media sampling. We'll develop PFAS action plans, which will include a compilation of data from the community, confirmatory environmental media sampling, and recommendations. And finally, we'll reflect on that community engagement process to refine and replicate our community engagement process in other impacted communities in need of PFAS action plans. Next. Through these activities, we expect the following outcomes. Community members in affected communities will have an increased understanding of PFAS, PFAS sources, and potential impacts of PFAS contamination and exposure as a result of our outreach and education. Community members will be active participants in the investigation and decision-making involved with PFAS action plans, and 15 PFAS action plans identifying PFAS sources and providing recommendations for how to address those sources will be completed. And then a community engagement model will be established from lessons learned during the pilot and integrated into DEP's PFAS action plan development process for additional effective public water systems throughout the state. And ultimately, we expect a reduction of PFAS contamination across West Virginia and improved public health for all West Virginians. Next. And now I'll pass to Autumn Crowe, the interim executive director of the West Virginia Rivers Coalition, who will share details of the planned community engagement process.
Thanks, Scott and Casey, for providing the background information on the extent of the PFAS problem in West Virginia. West Virginia Rivers Coalition is really honored to be the community-based organization partnering with DEP on this EPA grant. And as they mentioned, we're just getting started in this process, but this process is going to be instrumental in involving community members to take an active role in addressing PFAS contamination in their drinking water sources. Can you move to the next slide? So as Casey mentioned, the goal of this project is to develop a community engagement model for 15 action plans in 11 communities. As you saw from Scott, this is a step in the right direction, but it's barely scratching the surface of the extent of the PFAS contamination. So this is a critical first step in addressing PFAS contamination in drinking water sources in West Virginia. Next. So as Casey mentioned, we're targeting the northern and the eastern panhandles in West Virginia. And in the Eastern Panhandle, this includes the communities of Berkeley Springs, Charlestown, Harpers Ferry, Kearneysville, Martinsburg, and Summit Point. So the Eastern Panhandle is one of the regional hotspots for PFAS contamination. Next. And then in the Northern Panhandle, we have 5 additional communities: Bentwood, Chester, Follansbee, Glendale, and Weirton. So these are the 11 target communities that we'll be working with to develop those 15 PFAS action plans. Next. We have a whole list of partnering organizations. I won't go through each one of them, but I'll just say that these 20 organizations that we're partnering with, they are going to be critical in the overall success of the project. These groups in these communities, these are the trusted voices in their communities that community members rely on for factual information. So we're going to be really fortunate to work with such a broad group of organizations in these 2 regions. Next. So these local partners will be helping us to research innovative and inclusive methods for the community engagement process. We're going to convene a design committee with project partners, and this is going to be really critical in the first step of the entire process. So the design of the community engagement process is really going to set the stage for how we get input from the community on these PFAS action plans. And the local participation is critical. As Casey mentioned, these community members know the history of their communities. The example with the firefighting training happening in that field, we wouldn't have known about that without that community member disclosing that information. So it's very critical that we include the community members with that local knowledge to determine the possible sources of PFAS. So education and the outreach in the communities is going to be huge in getting them involved in this process. Next slide. So we know from our experience in developing the source water protection plans that we had done, I guess it was about a decade ago following the water crisis, that public participation is critical in developing a plan that is applicable to that unique community. And each situation in the state is going to be different. So, so involving the local community is critical. And as we learned when we were developing source water protection plans following the water crisis, that developing a blueprint is a good first step in educating the community. So in preparation for this project, West Virginia Rivers Coalition published this PFAS blueprint, which provides recommendations for how the state should implement the PFAS Protection Act. So this blueprint includes an introduction to PFAS. As we've heard from earlier presenters, this is a very complex issue, and providing that background information on the sources of contamination and the overall health impacts is going to be really useful in educating the community members about why we need these PFAS action plans. And we also have recommendations on how to develop those action plans, including how to identify the sources of PFAS contamination in these drinking water supplies. And then we provide 10 additional policy recommendations, additional steps that we can take to protect our communities from PFAS contamination and the health impacts associated with that. And then finally, the blueprint provides stakeholder and community engagement recommendations. And I'm happy to report that, our recommendations in the PFAS blueprint are incorporated into this, the process that we're going to be undergoing with this grant. Next slide. So for the community engagement process, with our local partners, we're going to identify community ambassadors. These are community leaders that are trusted in the community and can spread information around to their community members. We're going to initiate education and outreach in the communities, including film screenings to bring the community together, providing childcare to remove some of those barriers that would prevent people from attending, and then hosting the community meetings, and the information gained from that is going to be incorporated into the action plans. So we'll then evaluate the effectiveness of that process and then tweak it if needed to be able to replicate it in other communities. And like I said, we're just getting started, but we really look forward to sharing our successes and lessons learned from this project. And with that, I can pass it over to Noni Howe with the Maryland Department of Environment.
Good morning. And in the interest of time, I just want to introduce Yander Chang from our program, whose dedicated work led to a proactive engagement with the industry to conduct a phased approach survey. So in interest of time, Yander, I'm just going to turn it over to you.
Good morning. Hi, everyone. Today, I will provide a overview of the PFAS survey conducted at the wastewater treatment plant across Maryland in the last few years. This presentation will cover the approaches taken in the study and the key findings. Next slide, please.
You can go ahead and turn your camera on if you'd like.
Okay. Can you see me?
Yeah, thank you.
Okay. All right. So the next slide is a brief recap on what we know about PFAS. PFAS is a group of chemicals that is currently, if we know, is more than 7,000 of them. And they were designed to better our life since the 50s. And they were designed to have very strong carbon fluorine bound, so they can, and also with a surfactant light of nature, so they can be heat resistant, flame retardant, oil grease resistant, water resistant. But because all those natures tailored for our conveniences, they also become a nightmare when they come to the resistance of degradation in the environment, as well as they're easy to be bioaccumulated into the human body. And that is causing, so far already known, that there are health complications such as immune system, endocrine dysfunction, also inducing of cancers. That's why we need to find a solution to mitigate the sources of PFAS entering the environment. Next slide, please. So the next slide is regarding wastewater treatment plant, which is what my main responsibility in the Department of MDE is. As you know, there are multiple sources for PFAS to enter wastewater treatment plant. Therefore, wastewater treatment plant is a critical conduit for PFAS to get into the environment. From daily life the household good product can enter in through the collection system. There are also industrial users that can have through their manufacturing process, their wastewater can enter the treatment plant. The other two less known sources, you can enter in because they are also, as you know, there's a pipeline. If there's a pipeline, there's going to be a leak. There are groundwater that can infiltrate into the collection system, and that may carry the runoff from a fire protection drill facility, or there is storm sewer that can combine the stormwater runoff. That can also be a source of PFAS entering treatment work. And once you get into treatment work, and everybody need to keep in mind that these treatment plants, they are not designed to treat PFAS. Therefore, the most PFAS will be getting is almost a redistribution of the speciation or the congenital distribution among themselves, and then they will leave the treatment plant, go into different locations, be that coming from the surface discharge, coming from spill irrigation, or come through the biosolid, that is the sludge, to be applied onto the land, and then wind up in our surface water and groundwater again. Next slide, please. So, knowing the complication that and the crucial role of a wastewater treatment plant has in this PFAS passages, we are mindful of selecting the following facility categories in our survey. So we picked the next 4 categories as the focus of our survey. Number 1 is the facility with industrial users within their service area that is known to have PFAS in their operations. The number 2 category is the facility with a plan to reuse treated wastewater as drinking water sources. Ironically, in the last few years, we have been very much encouraging a facility to participate in water reuse, but because the PFAS, so a lot of plants are currently being put on hold and waiting for those survey to be done and do further evaluation. And then the third category is the facility implementing a new sludge management and treatment process that could elevate the PFAS level. That's another issue. As everyone know that the sludge handling and sludge management has been a pretty costly operation for all the wastewater treatment plants. So these, in the recent years, a lot of facilities, a lot of utilities, they try to come up with some ingenious treatment process to reduce the bulk of their sludge, and then during the process also, they can create some renewable sources to like methane gas to power their utility. So that's what's also encouraged. However, this type of process now has become a potential major source of PFAS that is coming from the wastewater treatment plant. Therefore, we also select the facility that is currently with this type of plant that as part of our survey target. Number 4 category is facility with practice, including effluent discharge or sludge disposal that may direct impact the safety of water supply or agricultural aquaculture product. This is related to facility that may have their effluent to be sprayed onto agricultural field or biosolid applied to agricultural field, and then surrounding the field, then there will be perhaps there will be shallow wells that serve as a drinking water supply sources. Those are also the target that we are want to get to see what they fare against our survey. In the meantime, I also want to mention that Maryland being next to Chesapeake Bay, we have a pretty extensive aquacultural practices around our area. Therefore, we are also paying a lot of attention to the facility that is discharged into those major aquaculture areas. Next slide, please. So with all the above in mind, we came out and set our approaches and the goals that we want to achieve. So first, we want to understand the level of the distribution of PFAS congeners within the treatment plant work of the Maryland wastewater treatment plant. So we want to have a general idea of what are the prominent PFAS speciations within the effluent and within the biosolid that coming out of Maryland wastewater treatment plant. And secondly, we want to develop a so-called the median baseline level for PFAS chemical. And this is probably the most important information we want to get out of the survey, because up until now, everyone has heard about the drinking water MCLGs for those PFAS containers, but I think there is still a way to get to in terms of the water quality criteria or the fish consumption criteria. So we want to have the information at hand so we can actually prioritize to identify the facility that need to be looked at first, and while waiting for this other information to be generated or to be passed down by EPA. So that's why we try to come up with the MBL. And then if we have surveyed enough treatment plant with sizable data, that means that statistically, that median value will mean a lot in terms of when we try to do a decision-making process. So we will use the MBL as the benchmark to identify facility that with high potential risk. And then based on the evaluation, we'll add additional monitoring requirement and future action plan for the surface, for the source tracking and the mitigation. Those requirements will be implemented in the MPDS discharge permit for facility with the higher risk. This is the purpose that ultimately because we know that addressing PFAS mitigation issue is going to be a long-term effort. So we want to have those requirements to be registered in the discharge permit so that it will carry with legal forces that will go a long way. Next slide, please.
Yender, we have about 2 minutes left.
Okay,
Thanks.
so thank you. So overall, we have gone through 3 phases of survey, and altogether we have 120 events surveyed through 102 facilities. And next slide, please. So within the treatment plant that got selected, we will pick the 3 locations to collect our sample: the influent, the sludge, and the effluent. And all the samples are being taken as the format of the composite batch. And also it was analyzed mostly in the state Maryland Department Health Laboratory, which is one of the first get certified to run the EPA 1633 method that is specifically dedicated for wastewater analysis for PFAS compound. Next. So here are some of the results that we have obtained so far. What you see here is the MBL level that we have to observe for the 40 chemicals that are covered by the 1633 method. I have deliberately highlighted the one that recently has the MCL that being finalized by EPA, so that you can understand what whether they are prominent or not within the findings. The next slide. The next slide is what we found within the biosolid. Once again, this is where the MBL is for biosolid producers. Next slide, please. And then this is the 5 prominent PFAS containers that recently being released with the MCL and MCLG. So we stack them together and we'll look at this is just the 5 of the spray irrigation side that we are currently looking at as an example. We stack those the concentration of the finding together and compare against each other to see which one we should take action first. Next slide, please. And this is the chart that once again the 5 containers that covered in the recent drinking water MCLG. We stack them for the facility that producing the Class B biosolid, so we can kind of figure out which one we should tackle first. Next slide, sir. So once we have all the information, we as we had mentioned earlier, that those one that are being identified as higher risk will have the requirement of the further monitoring and additional tracking, and with an action plan incorporate in their future discharge permit. For some of the spray side, we also want to ask them, in addition to the effluent sampling and the biosolid sampling, we also ask them to sample in the monitoring well that's surrounding their spray site. Next slide, please. So this is what's next. This year, the Maryland legislation has passed down the House Bill 1153 and the Senate Bill 0956, that is the Protection of Water from PFAS Pollution Act. So it set a very aggressive schedule, starting from the September this year until the July of 2026. We are going to identify the major industrial users for all the wastewater treatment plant that we associate with them, and then we'll have to come up with the policy to regulate and mitigate the contribution of the PFAS coming out of those industrial users. So we have plenty of to do in the next couple of years. That's my presentation. If you have any questions, feel free to contact us. Now I'm going to pass it to Hunter.
Thank you everyone very much for attending today. On the slide and in the chat, you have the contact information for all of the speakers today who you may have questions for. The next session is beginning in the main Zoom room at 12:15 over lunch. Please exit this room, go back to the Zoom lobby, and feel free to enjoy the lunch session. We will see you this afternoon. Thank you all for coming, and thank you very much to all of our speakers for sharing today.